Maricopa County Department of Public Health uses death certificate and laboratory test information to estimate the number of COVID-19 associated deaths in the county. For example, COVID-19 was probably associated with the death of a person due to a heart or lung-related condition shortly after being diagnosed with COVID-19, even if COVID-19 was not listed on the death certificate. In order to capture most of the deaths associated with COVID-19, those diagnosed with a COVID-19 positive PCR test who die within 60 days are considered COVID-associated deaths in Maricopa County Public Health's death surveillance numbers. As of Tuesday, August the 25th, there were 2,804 deaths where COVID-19 was present. 7 of these, or 0.02 of all these deaths, had resulted from injury or poisoning without COVID-19 being listed on the death certificate. These account for things like trauma, car accidents, gunshot wounds, and even drug overdoses. Data on COVID-19 associated deaths will be reviewed regularly to remove from the counts those who died due to causes such as car accidents, gunshot wounds, or drug overdoses, if COVID-19 is not otherwise listed on the death certificate. Data on disease-associated deaths are frequently reviewed in more detail, often requiring things like medical records to be reviewed. This happens after outbreaks are over to finalize the number of deaths caused by and associated with a disease. We know that any COVID-19 death surveillance likely undercounts the number of people whose deaths are associated with COVID-19, and this is probably reflected in the increase of all-cause mortality during this pandemic. We will have the final count of deaths caused by and associated with COVID-19 after the pandemic.